We are being led to believe that if we control human beings, we can control a virus. If we wear a mask, stay 6 feet apart, and social distance, we can keep COVID from spreading. That isn't how a virus functions. All of these measures are psychological crutches to make society feel good. Well, perception is not reality. None of the measures in place actually prevent or stop the spread. COVID-19 is mainly spread by microscopic aerosols generated by breathing, talking, sneezing, and coughing, exactly the same way other viruses are spread. The vast majority of these infectious aerosols easily penetrate common masks. 90% of the aerosols are 1/17 the size of the pores in surgical masks and 1/80th the size of the pores in the cloth masks, and light enough to stay airborne for hours, which allows them to freely travel through the gaps around the edges of these masks. The idea of masking did not suddenly appear in March of 2020. The usage of face masks at preventing infectious disease has been well studied, and the conclusion is they are ineffective. If they were effective, we would have been wearing them long before COVID emerged. The studies have failed to produce results that support any benefit of masking healthy human beings, let alone young children with developing brains. N95 masks must meet strict filtration standards and be professionally fitted to each user's face to form a tight seal. In addition, OSHA requires employers to conduct a medical evaluation of each employee required to wear an N95 due to how heavily they restrict breathing and the burden they can place on the wearer's overall health. N95 masks purchased and worn by the general public are not fit checked and therefore cannot be expected to filter effectively. Surgical and medical masks are primarily worn to limit large droplet transmission. The FDA's COVID-19 guidance for these masks states that they cannot be labeled for antimicrobial or antiviral protection and cannot make filtration claims for particles of any size. These masks have a poor fit and filtration and cannot be expected to significantly reduce the inhalation of infectious aerosols. Cloth masks are made of common fabric and are highly permeable, and they become even more permeable with every wash cycle. A 2015 study of cloth masks concluded that particle filtration was extremely poor, at almost 0%. They were found to cause significant disease transmission and were highly discouraged in the use of infection prevention. The FDA explicitly states that under emergency use authorization, surgical or cloth masks cannot state or imply that they are intended for use as infection prevention or reduction. They must state that not because misuse may result in a lawsuit, but because these masks simply do not present the capabilities to prevent the spread of a virus, and to label them as such is false advertising. In 2019, the WHO conducted an analysis of numerous randomized control trials related to masking and found that there was no evidence that masks reduce the spread of viruses in community settings. In 2011, the Journal of Influenza and Other Respiratory Viruses published just a review of scientific evidence on the use of masks to prevent the transmission of influenza. It concluded that none of the studies they reviewed established a conclusive relationship between mask use and protection against infection. The masks sold in stores for the general public to wear are nothing more than a feel-good measure. Not designed or intended to prevent, mitigate, treat, diagnose, or cure any disease or health condition, including COVID-19 or coronavirus. Not intended for a medical purpose. Not a replacement for medical-grade personal protective equipment. This general mask cannot eliminate the risk of contracting infectious disease. These are all labels on the packaging of the very masks we are being mandated to wear. Why are people so willing to ignore the conclusive data stating the ineffectiveness of masks and somehow demand others wear them, knowing that they have little to no infection prevention? Misleading the public into thinking these very masks are reliable protection in the spread of coronavirus is a failure of leadership. A leader should use both common sense and expert opinion to make these decisions, and somehow our elected government officials are doing neither. Mandating a person continue to use a medical intervention proven ineffective is nothing more than making them play pretend. Even if these masks were effective in prevention and the spread of COVID, the general public isn't even wearing them correctly. The very people sitting in this seat demanding we force our children and others to wear masks are continually touching and adjusting them, while others wear them completely under their nose. They also remove the mask entirely to talk into the microphone with no regard to proper donning and doffing procedures required for mask wearing. A quote by Dr. Martin Luther King Jr. says, "One has a moral responsibility to disobey unjust laws. Just because a mandate is passed down from a totalitarian leader does not mean it is always in the best interest of the people. We have a moral responsibility to question those governing us. We must stand up and speak out against injustices, especially when it comes to our children. For masks, there's a simple solution, and one that doesn't mean tossing out our individual civil liberties, and it goes like this. Those who choose to wear a mask can do so, and those who don't are not mandated against their free will."
Thank you.